I think Steam key is the problem. Yes, sir, it is coming now. Yes, sir, there is audio glitch. I think Steam key is the problem. Yes, sir, it is. Check hello. Check hello. Yes. Hello. Check hello. Students, good evening. Please wait for 2 minutes. There is a technical problem. We'll be back. So don't go. We will be going to start the session within 2 minutes. Okay? Yes. 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 Good afternoon, all. We are again back to the session on the Wednesday series. So we have completed the Wednesday series. Now we are at only 2 more days are there. Almost only 72 days for NORCET, right? 72 hours. Sorry, 72 hours is only for your NORCET 9.0, your dream job, everything you can achieve. I hope you guys have done lot of works regarding this. You have put a lot of efforts to crack the NORCET. We have need some revision, right? So I came up with lot of important questions. We came up with lot of important questions, high yield questions related to OBG. We are going to discuss some 50 plus questions today. I hope this session will be helpful. We are yet to the path to reach the NORCET 9. This prediction series will help you to revise all the concepts clearly. Okay, shall we start? Is that audio is clear now? Well, Murugan, Rajkumari, Rajdurai, everything. Yes, everybody, welcome. Good afternoon. Good afternoon. Is it clear now? Shall we start the session? So, in this session, I hope I will not explain much, but you're going to answer. I will explain whenever needed, but you people are going to answer, okay, related to this MCQs. Okay, shall we start? Yes, thank you. First thing, identify the maneuver shown in the image below, whether it is Pregg's maneuver, Ridgen's maneuver, Merrique Smalley-Witch maneuver, McRoberts maneuver. Come on, tell me. Yes. It is Pregg's maneuver, correct. Here, there is upside down, followed by full extension of the fetal foot. This is done in bridge delivery, right? You all know about that. So coming on to this Ridgen maneuver. It is used to control the delivery. Here you can see 3 images are there. I hope these images are visible. Now tell me which maneuver is this, which maneuver is this, and which maneuver is this. So everything I have given. Okay, yes. In this regen maneuver I will explain. Here we are having controlled extension. Okay, controlled extension we are using. We are delivery of the fetal head, okay, followed by we are keeping some at crowning. With the help of perineal support, controlled extension we are giving, that is regen maneuver. Here you can see the after the crowning the fetal head is holded by the obsession. Okay, yes, then the support to the fetal chin. Okay, the face support is given, then the delivered with controlled extension. Okay, not hyper extension. Coming on to this, what is this? Come on, tell me. Yes, it is Meg Roberts maneuver, especially for shoulder dystocia. Okay, especially for shoulder dystocia. Coming on to this, what is this? Here, two clinical persons are going to support during the delivery. What are they? Suprapubic pressure is given, as well as controlled traction is delivered. Then the baby is delivered in the swing through, that is upside manner. This is Merriquet-Smiley-Witch maneuver. Always remember, 2 persons are holding during the delivery. That is the important thing you should note here. Is it clear? Yes. Okay. First is, this is called regen maneuver. Okay. This is Preg's maneuver. Okay. The fetal, during the breech presentation, the fetal foot is hyperextended and delivery to the shoulder. This is called Preg's maneuver. Okay. Yes. Is it clear? Next question. Identify the obstetric condition shown in the image below. It is easily, you can remember this because it is a repeated question. Yes, malar flexion, shoulder traction. Correct. Yes. Correct. Vinita, correct. You are correct. You are correct. Yes. You are correct. Yes. It is Bandel's ring or physiological retraction ring, uterine inversion, Scrogen, that is Scroden's ring. Okay. Yes. It is Bandel's ring. What about the retraction ring and uterine inversion and this Schizoidus ring? It is called as constriction ring. It is called as constriction ring, where the fetal head and the neck, there are, due to the uterine problem, there will be excess pressure towards the fetal neck. There will be there. That is called this Schizoidus ring or constriction ring. This is Bandel's ring, you all know. So that is the answer. Coming on to this, here you can see the constriction. Okay, here you can see the constriction. There will be normal abdomen layer and also the uterine layer will be normal. Only due to the uterine problem, there will be the constriction, that is constriction towards the fetal neck. So it indicates fetal hypoxia. This is called this constriction ring. Okay. Yes. Coming on to this is the normal shape of the abdomen. Due to the lower abdomen uterine, there is upper uterine segment and the lower uterine segment. Why it is happening? Okay, it is retracted and the lower uterine segment is distended. This is called this Bandel's ring. Can anyone tell why this Bandel rings is happening? Yes, due to obstructed labor it will happen. Yes, correct. Yes, correct. Tanya, you are correct. Yes, due to obstructed labor it can happen. Is it clear? Yes. Everybody will know the answers, but always look after your distractors. Okay, I will give you, before going for this question, you all know about this question, right? Before going for this, I will tell you beautiful clue how to approach your exam MCQs. Okay, there are 18 minutes in your hand in section A. In section A, always split 9 by 9 rule. First 9 minutes, it is very crucial. First part. First, you have to analyze the questions for the first 2 minutes. What are the questions came? From which are the subjects they have given in this section? First, you have to go through the question. Then after 2 minutes, within 5 minutes, 100% known questions you can attend. 100% known questions you can attend. It might be 8, it might be 7, any number. So after 7 minutes, you will be having around 10 to 11 minutes in your hand. You can go through all the other MCQs which you are not attended and try to reduce your negative marks. How to reduce your negative marks? Simple. If you don't know the question, don't attend. If you know the question, attend. If you know 50% of the question, take risk only 5%. Don't take more than 5%. So how it is 5%? If you know prediction, that is 50% known questions are 5, you can take 50%. That is 2 questions. You can take risk. You can attend. Try to attend. Grab up some of the important concepts. Then rewind your revision. Everything you will get in your mind during your exam. That time, if you able to solve 2 questions, that is enough. Okay? Yes. It is well-mentor separation. You all know. Yes. Coming on to this next thing, that is, what are the other options here? Well-mentor's insertion, you all know. You can easily able to grab up. Here, the confusion between is second-weight lobe and bilobe beta. Bilobe beta is like heart-shaped thing. We will say the lobe is divided, but it is not removed. It is attached. It is separate lobe will be there. That is second-weight lobe. Coming on to this circumvallate, there will be a circumferential insertion will be there. Coming on to this circumvallate, there will be a decreased portion in the central part. This is how you should remember. Okay? Yes. See how many questions if you are going to attend. Sugant, yes, Dingra, I will tell you. So for all people, I will tell how many questions you are going to attend. It depends upon the question paper. If it is an easy question paper, easy means all the sections, 4 sections, if you know more than 18 questions or 15 questions, then it is an easy question paper. That time you should attend 70 plus questions. 60 to 70 questions, you are safe. Okay, if it is a moderate question paper, 60 is enough. If it is a tough question paper, 50 to 60 is enough. Okay, always it depends upon the question paper only. We should decide and depends upon the competition. We cannot able to predict, but AIIMS have given that 50 is the pass mark. That is, you are eligible for to write mains, but you are qualified for mains or not. That is the thing you should note. Okay, yes. Yes. Coming on to this question, can anyone answer this? Match the following questions. So these type of questions are time consuming. Hopefully you should not attend in the first 9 minutes. Postpone it to second of 9 minutes. Okay, because though it is very easy, it is very tricky. It will consume your time more than 2 minutes. Okay, yes. +70 questions should be correct. That is not a problem here. If you attend 70 questions, there might be 10% of negative mark will be there. Knowingly or unknowingly will be giving. Including that, 60 questions will be correct. Your mark will be around 61 to 62. Then you will be definitely you are going to be in your mains. Okay. Yes. Here, magnesium sulfate. What is the dosage? That is the one thing. What is the therapeutic range? We will tell. Therapeutic range, anyone can tell? what is the therapeutic range, and what is the dosage where we are going to give. Okay, magnesium sulfate. Come on, match. I need the match, perfect match you should do. It is an A for 1 or 4. Okay, oxytocin. Oxytocin is same, right? Yes. Misoprostol, it is an prostaglandin E1 analog, cause uterine contraction and ripening. Yes. Uterine ripening, cervical ripening, if the word comes, that is misoprostol. Yes. Methyl ergometrin, it is causes sustained uterine contraction via alpha adrenergic reaction. That is correct, right? Yes. 4 to 7 milliequivalent, that is very right answer. If it is more than 7, then it indicates toxicity. First and foremost, you have to assess deep tendon reflexes. Okay, what is the most common toxicity? Late complication, if they ask, that is respiratory depression. Early cause, if they ask, that is DTR. Okay, DTR will be +2. It will be increased. Okay, yes. Yes, it is A. Coming on to this next question. Identify the given image below contraceptive and choose its mechanism. They are asking about this Depo-Provera. Come on, tell me. Respiratory is the late sign. DTR will be the early sign. Okay, yes. Hypomagnesemia and hypermagnesemia, what will be there? So hypermagnesemia, there will be decreased DTR will be there. If it is hypomagnesemia, there will be increased DTR will be there. Okay, yes. Coming on to this question, first identify this methylprogesterone, right? It inhibits FSH release and prevents ovulation, inhibits LH surge and suppressing ovulation, creates mechanical barrier to sperm, prevents fertilized ovum implantation via copper toxicity. Yes, you are all right. I hope you don't need this session. You all know all the questions. For the past 6 questions you answered correctly. Yes, this is what we want. You're all confident. Okay, be confident. You are going to get NORCET 9. Okay, don't worry about that. Okay, how it is going to inhibit the ovulation? LH surge peaks at day 12 to day 13. Okay, we are having this is menstrual cycle of till day 7. This is day 28. Mid cycle 14 is called ovulatory phase. This is pre-follicular or pre-ovulatory phase. Pre-follicular, post-follicular or post-ovulatory phase. Simple in terms, this before 14 days, follicles will develop. After this 14th, follicles, mature Graafian follicles will release. Remaining follicles will form corpus luteum, progesterone is produced. During this, theca cells produces estrogen. Here corpus luteum will produce progesterone and estrogen. Okay, this is how you should remember. Estrogen has both positive and negative feedback. Estrogen has both positive and negative feedback you should have. And if they ask proliferative phase, secretory phase and ovulatory phase. Ovulatory phase you all know. That 13 to the viable period of the ovulatory phase, that is 12 to 24 hours. Okay. Proliferative phase, where the proliferation is going to happen after 7 to 14 days. Secretory phase after day 14 till the menstruation occurs, that is secretory phase, where after the endometrial layer sheds. This is the short form. Okay, just remember these points, that is enough. Okay, yes. Here comes the point. This dopa, that is methergine, IM 150 mg for 3 months we are going to give 12 weeks. Okay, yes. Subcutaneous formulation also available, 104 mg subcutaneous every 12 to 14 weeks. That is dopa That is the drug. What we have discussed? Yes. Depo-provera. That is the trade name. Okay. Depo-provera drug. It inhibits ovulation, thickens the cervical mucus and thins the endometrial layer. Okay. Yes. It prevents the sperm penetration also and also implantation. Next question. Is it clear? Yes. It reduces blood loss also. A 34-year-old multigravida. Now you people are teaching me. Yes. This what you should be, that much preparation you have done. So whatever points I missed also you are giving me in this comment box. I am very happy that your people have learned that much things. Okay. Yes. Quick fast. Multigravida at 32 weeks of gestation presents to the emergency department with sudden onset of severe abdomen pain, vaginal bleeding and uterine tenderness. It is easy, right? Abrupto placentae. If it is painless, then we can go for placenta previa. Now tell me, what are the types of abrupto placentae? It is concealed and revealed. And another one type, that is mixed. Concealed will be in the upper uterine segment. If you take, this is the uterus, concealed will be in the upper uterine segment. What is the clinical sign? Uterine size will increase. Abnormal uterine enlargement will be there. In revealed type, there will be profuse bleeding. In both these types, there will be pain is the constant thing. So what is the most common cause for abrupto placentae? Yes, tell me. Most common cause is always trauma. What is the complication of abrupto placentae? Complication, if you talk about complication, what is the complication? Covalent uterus. Yes, correct. Yes, correct. Common cause, if you talk, that is trauma. Always trauma. If the word see a trauma, that is trauma is the answer. Complication, if you say, that is DIC. Disseminated intravascular coagulation. Okay. Yes, correct. Hopefully these are some important points you should remember in this center. Pre-eclamptic mother is receiving magnesium sulfate therapy. Which of the following indicates that the therapeutic level of MgSO4 has been reached? What is the therapeutic level? If it is reached or not? See, in uterine rupture, there will be increased pain will be there, including tenderness, and you can see hypovolemic shock. Hypovolemic shock in profuse when compared with abrupto placentae. In uterine rupture, sudden profuse bleeding along with pain and hypovolemic shock will be the classical symptom you can see in uterine rupture, and it is most probably with previous LSCS. Previous LSCS mother are prone to get this. If previously there is an LSCS, if they are going to try normal labor, there is chance of uterine rupture. Okay. Increased fundal pressure also one of the major cause for this uterine rupture, and there will be profuse bleeding along with pain, and classical sign is hypotension, tachycardia, cold clammy skin will be there. Okay, cold clammy skin will be there. Okay. Yes. Come on, tell me which will be the answer here. What about the respiratory rate? What about the absence of patellar reflex? It will not be there, right? Deep tendon reflexes +2. That will be the answer if it is reaching the therapeutic level or not. So here comes the signs, I will explain. Hyporeflexia, absent patellar reflex. That is the first early sign. Okay. Coming on to this difference, 7 to 10 is mild. Loss of D temperature, that is the earliest sign. So if it is 10 to 13, obviously respiratory depression will be there. And if it is more than 15, it indicates cardiac arrest. Okay, it indicates cardiac arrest. These are the important points. Coming on to the urine output also plays a vital role. Sometimes they will not give this DTR, respiratory, everything. They may give oliguria also. They will give hypotension plus bradycardia. Okay, hypotension plus bradycardia, because it is an CNS depressant. You can see in neurogenic shock the same symptom. Hypotension plus bradycardia you can see, because MgSO4, that is magnesium, is a CNS depressant here. Okay, yes. Yes, correct. Yes, correct. I think these are some important points. You all know what is the antidote? That is calcium gluconate. We have to give slow IV. It can induce cardiac arrest too. Okay, check what is the nurse's role here. Check DTR. Ensure the respiratory rate more than 12. Normal respiratory rate, that is 12 to 20. Okay, 12 to 20. Yes. Ensure uterine output, that is urine output, sorry, that is 30 ml per hour. Monitor serum magnesium if it is an prolonged therapy. Okay, calcium gluconate, you all know about it. Okay, yes. So identify the item shown in the image. I will explain. Yes, correct. Identify the instrument. So it is easy, right? You will all answer. That is pap smear kit. This is RA spatula. Okay, yes. Here comes the question. What is the recommended prophylactic dose of iron and folic acid for pregnant women as per guidelines of Government of India? Yes, RA spatula. Yes, correct. Which slide you want? T. Therapeutic range, that is 4 to 7. Easily you can remember. Earliest sign is, that is DTR, decreased DTR will be there, loss of D tendon reflexes, and late sign is respiratory depression, and most complication, that is CNS depressant. Okay, cardiac arrest and CNS depressant. Toxicity signs, if you take, that is hyporeflexia, then you can compare with respiratory depression, then oliguria. Then afterwards it comes with hypotension, with cardiac hypotension and bradycardia due to decreased cardiac output, CNS depressant, that is drowsiness, and patient is going for coma. These are the things you should note. Okay, always remember nurse's role is to monitor the clinical signs. Okay, not the therapeutic range. Okay, clinical signs is the first and foremost assessment for the nurses. Don't confuse between the words. They will have some tricky words to you. Please go through the question once before answering. Okay, it is very easy if you got a keyword. If you don't getting a keyword to the question, always remember there will be a keyword. Please go through the keyword, then answer. Okay, without knowing the keyword to the question, don't answer. Here in this question, MgSO4 therapy, pre-eclamptic mother. So what is the keyword here? They are asking about therapeutic level. Simple, indirectly it is telling MgSO4 toxicity. So your mind should think, what is the earliest sign, what is the late sign. Let's think about earliest sign, that is D tendon reflex. Respiratory rate is also there. Urine output is less than 25 ml per hour. But which is very important, this is also a complication, this is also a toxicity sign. This is also a toxicity sign, this is also a toxicity sign. Which you will choose? Priority. Earliest sign is D tendon reflex, that you should choose. Okay, yes. Next question. Yes. What is the recommended prophylactic dose for iron and folic acid for pregnant women as per the guidelines given by the Government of India? First sign of toxicity is I have told, that is DTR reflexes. Yes, yes. See, hyperreflexia will not be there, hyporeflexia. Already I have told. It is B, right. So what is the dosage for adolescent as per Ministry of Family Welfare? Recent updated guidelines, that is 100 mg elemental iron plus 500 mg folic acid. This is recent updated concept, that is for adolescent between 14 to 19 years. 14 to 19 years. Okay, deep tendon reflex. Yes, correct. Correct. You all know about this, right? Yes. No need to discuss this much on this topic. Now comes the question. Match the following question. Always I am telling you repeatedly, if match the following question comes, if SATA question, select all that apply, reasoning and assertion question, drug calculation, if such questions which are time consuming, don't attend the question in the first half session. Postpone it to second 9 minutes. Okay, then it will be very valuable because you will save much time later to this type of questions. Okay, yes. Yes, correct. Lausitz maneuver, Pinard's maneuver, Ridgen's maneuver, Bands Andrews technique. So, if you know what is Lausitz's maneuver, delivery of shoulder in breech. Come on, tell me. A is for Pinard's maneuver is delivery of extended leg in breech presentation. Ridgen's maneuver is delivery of placenta. Shoulder. Come on, tell me correctly. Let me check the answer. So that is A. So A is 4, B is 1, Pinard's maneuver. Ridgen's maneuver is controlled delivery of the head, and D is 2, right, delivery of the placenta. Now I will explain this. So what is this? What is this and what is this? Yes, this is Pinard's maneuver. So what is this? This is not Lausitz's maneuver. This is controlled traction. This is Ridgen's maneuver. This is Band Andrews maneuver, where the umbilicus is controlled traction is given with holding of the fundus. Okay, you can see here there will be umbilicus is pushed upward. Okay, yes, correct. A 13-year-old, that is a woman, gave birth to stillbirth baby who showed signs of hydrodrop fetalis and petechiae over the skin. Which of the following infection is most likely the cause? Stillbirth baby, most likely cause of? Yes, correct. So we are going to fastly, we are going to revise. Okay. Yes. Correct. Thank you so much for all your answers, Roshini, Suryashchand, Tirsota, Vinita, Rapa. Thank you all. So here comes your confusion questions. What is parvovirus B19? It is also called as sixth disease. Sixth disease. So always remember, after stillbirth, there is possibility of cytomegalovirus. Okay, they've given petake over the skin, hydrodrop fetalis, that is the keyword, which is the hallmark sign for cytomegalovirus infection. Okay, yes. See, A will not be the answer because it is a sixth disease. It will not affect in stillbirth. How can we say it affects the stillbirth? Okay, it will not affect the stillbirth babies. Okay, it will affect cytomegalovirus is the most common sign in who gave birth to stillbirth, who showed signs of hydrodrop fetalis and petake. This is the hallmark sign. It is after delivery. Okay, yes. Rubella will causes congenital rubella syndrome, but it will not be in stillbirth. Okay, yes. If it is less than 16 weeks, there is most probability to give, that is congenital rubella syndrome. After 16 weeks will not be there. Okay, yes. What is the misoprostol in relaxing cervical ripening? Already I have told cervical ripening, if the word comes, it is misoprostol. What it does? It enhances or prevent or delay or weaken. Yes, torch, correct. Fifth disease is, I think, infectum. Now tell me, for misoprostol, what it will do? Come on, tell me. Now tell me what it will. Yes, always remember that it will enhance. What and all it will delay, what drugs will prevent, we will see in the next slide. Okay, yes. Always it is an prostaglandin E1 analog. Yes, erythema infectosum, you have told. Okay, you people have discussed. It enhances cervical ripening by softening the cervix, increasing the collagen breakdown and stimulating uterine contraction, so that the cervical ripening is happening. Okay, it used in induction of labor, cervical ripening before the procedures like dilatation and curettage, induction of labor and medical abortion. Okay, delaying tocolytics like magnesium sulfate, nifedipine, terbutaline, delay labor, not misoprostol, tocolytics. Okay, yes. In gestational trophoblastic disease, which of the following is most commonly assessed for diagnosis and monitoring? Yes, misoprostol, prostaglandin, E1 analog. What it will do during the induction of labor? It will enhance the cervical ripening. Okay. Now, trophoblastic disease, which will be the answer? Easy question. Yes, it is HCG titer. Yes, you're all in fire. You're asking lot of doubts before the exam. Okay, I am just clear. I don't want to confuse you people in any regarding any concepts. Whatever the questions, you just go through that. Don't be confused apart from this. So after that, you can have your doubts. Okay, because our concept is to, these are predicted questions. I have taken some important points to you. So just grab up the points, take a notes, because this questions most probably we are predicting. We are predicting, and it might be your NORCET question. For that only I have taken this. Please go through the points which are I am telling. Okay. Gestational trophoblastic disease includes the hydatidiform mole, choriocarcinoma, and placental site trophoblastic tumor. Okay. HCG levels are more common regarding this, not estrogen, not progesterone or anything. Okay. Yes. Coming on to this, trophoblastic proliferation is seen most abortion. T and C can be treated with, okay, trophoblastic proliferation. What is single agent chemotherapy, adjuvant radiation along with chemotherapy and radiation, surgery, and combination chemotherapy? Combination is we will be combining with higher end chemotherapy and also with lower end chemotherapy. Okay, like cisplatin, anything can be identified. Yes, come on, tell me. Yes, single agent chemotherapy for trophoblastic proliferation. Now comes the question. Okay, yes. Which of the following statements accurately describe corticosteroids on white blood cell count and blood glucose level? Always remember, first you tell the answer, I will clearly explain you the concept of corticosteroids. Okay, yes. Yes, methotrexate. And always remember, if the patient is taking methotrexate, what are the side effects you can remember? Okay, there will be decreased ANC, count will be reduced, and patient will be having anemic, HB will be reduced, and elevated liver enzymes. There is most probably you can see, and there will be decreased platelet too. So you can see that is petake, purpura, everything can be seen if the patient is taking methotrexate, and there will be decreased urine output also. Okay, urine discoloration can be seen. Come on, tell me, corticosteroids will increase WBC count and increase blood glucose level. So this steroids has a property called, it will hold sodium. It will hold the sodium and leave potassium. If the patient is taking corticosteroids, there will be muscle cramps, decreased, that is muscle tone will be reduced. Okay, hypokalemia symptoms you can see, and hypernatremia symptoms can be seen. If the patient is taking corticosteroids, there will be, if toxicity is reached, then thirst center will be activated. Always remember, hypernatremia, thirst is the hallmark early sign. Hyponatremia, fatigue. Okay, yes. Yes, correct. Everything you are correct. Yes, petake, purpura, everything is correct. So I am discussing one topic, you people are answering, you people are discussing one topic, right? You are taking class for your colleagues. I appreciate that. It is very healthy conversation what we are doing, because this 3 days what we are going to revise, it will be in your mind. Okay, yes, correct. Thirst is hypothermia and fatigue is hyponatremia. Okay, yes, corticosteroids we have discussed. This is the important point. Metoprolol. What is the metoprolol? It is an beta blocker. Okay, Leprosor 25 mg per oral is ordered, and available dose strength is 50 mg. How many tablets you will administer? It is an easy question. Yes. Yes, correct. So we'll be giving 0.5 tablet or 2 tablets. So what is the formula? So this is simple thing. What is the formula? Desired dose divided by available dose. So 25 divided by 50, that is 0.5. So always you should remember the formula. Okay, even though it is a small question, don't be overconfident in answering. Always apply the formula, then you will get an answer, then you simplify it. Okay, yes. Yes, desired dose is 25, available is 50 mg, then you will be getting 0.5. Okay, yes, so it is 0.5 tablet. Yes. Identify the type of maneuver showed in the image. Yes, easily you can remember, like Tanya said, dose in hands divided by available dose. Dose in your hands divided by available dose. That we can say prescribed dose, we can say. What is desired? Prescribed dose divided by what it is available in the therapeutic form, which is in the solid form. That is the available dose. Yes, it is a Pavlik grip. Correct? Yes, it is Pavlik grip. Whether it is third grip or first grip or second grip. Now tell me, what is a Leopard's maneuver? First or second, third or fourth? Yes, it is fourth grip. Pavlik grip is third grip or fourth grip. Yes, Ballot check. So first I will tell in with this phone. First fundal palpation. Fundal palpation, then lateral palpation. Then I am checking the Ballotman, that is pelvic grip. First Leopard's maneuver, second and third. Then fourth is whether it is convergent or divergent. Okay, whether the fetal head is engaged or not. That we are going to see in this. That is lateral grip, fundal grip. Last one, that is pelvic grip. Okay, yes, it is third one. This is the fundal grip. First Leopard is fundal grip. Every year it is repeating, either in prelims or mains or any other platform, any other, like we can say apart from this ESIC or any other thing, they are asking these questions. Okay, please don't confuse lateral grip, that is second Leopard, third is Pavlik grip, and fourth is pelvic grip. Okay, convergent or divergent. Okay, sometimes they will give a scenario and they might ask you. Okay, yes. Quick, next question. Identify the maneuver shown in the below image case of breech delivery. Whether it is Merrique's melee wet, that is MSP maneuver, Brecht's maneuver, Lausset maneuver, or Pinard's maneuver. Pinard's maneuver, you all know, it is not a Pinard's maneuver because two clinicians, already I have told a clue, two clinicians are making the delivery. Okay, and the fetal breech, that is the whole fetal body is managed in the upward direction. Then it is called, yes, Merrique-Smiley-Witt maneuver. Okay, sorry if I pronounce this wrong, that is Merrique-Smiley-Witt maneuver. Yes, correct. Yes, correct. So next question, which of the following can be expected after amniotomy? Now tell me, which is the ideal time to do amniotomy? And come on, tell me. Uses gravity. Yes, correct. Now tell me. Yes, B. Yes, it is B, but I asked. Yes, that's what the answer. It is 16 to 18 weeks. Okay, yes. Quickening is the first movement felt by the mother in which trimester and which week? Come on, tell me. 14 to 16 weeks. Yes, that is the ideal answer. Increase cervical dilatation and effacement. Okay, next question. A female comes to the labor room with 4 centimeter dilatation -2 station, after 3 hours, there is no progression in the labor. Which step should the nurse anticipate in this case? Yes, correct. 20 question. See, after that, we'll do amniotomy or cesarean section or administer oxytocin. Now tell me. So why you're telling that amniotomy will be the answer? There is no point in doing amniotomy. First, induction. We have to start the induction. -2 station is there. After 3 hours, there is no progression. They have not told about the oxytocin infusion. So first, we have to start with oxytocin. That is the best answer. Now tell me this fetal head station. -2, -1, 0, +1, +2 station. This is at the level of ischial spine. Okay, this is below ischial spine. Don't confuse below ischial spine. This is above ischial spine. Okay, these are the things you should know. Don't be confused in these points. At the level, if they ask, that is 0, station 0. Station -1, -2, it above the ischial spine, above. Okay, this is below, this is above. That is the thing you should note in this stations. Okay, but they have asked about the progression of labor here. They have not asked about the station where is the fetal head is. Okay, please answer precisely what they are trying to ask us. Okay, which of the following components directly includes the Fisher score? Why the pen is not working? Come on, tell me. Picture score. What is this picture score? Yes, correct, 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 correct. Yes, correct, correct, correct. Now tell me, picture score means what and what are the components will be included? It is easy. What is picture score? What is picture score? Fetal heart rate acceleration. Why B and C? P. What is picture score? If the question is there, then you will able to answer. It is biophysical score. Okay, biophysical. What are the components? Fetal breathing pattern, fetal body and fetal body tone, muscle tone will be assessing an amniotic fluid volume as well as NST. Okay, body movements also is there. Fetal, that is fetal breathing movements, fetal body movements, fetal breathing, fetal body movements as well as fetal tone. Then you go for amniotic fluid volume. Okay, amniotic fluid volume and non-stress, that is fetal heart rate activity. No acceleration, no baseline fetal heart rate. Fetal heart rate, if the word comes, then it included along with NST. Okay, that is biophysical profile. Okay, yes. Coming on to this, if the baby is in the right occipito-posterior position and then rotates to the left occipito-posterior position, and what during normal delivery this movement is called? Come on, now you are going to tell what are the cardinal movements. First, engagement, descent, flexion. Come on, internal rotation, after that extension, resuscitation, external rotation, then expulsion. These are the cardinal movements, right? Now, engagement, descent, flexion, internal rotation, extension, external rotation, expulsion. Okay, these are the cardinal movements. What may be the answer here? So I have given you the clue. Now tell me the answer. Yes, it is internal rotation. Yes, you are all correct. You don't need any revision class. Yes, you all learnt everything. So, you all learnt everything. That is the problem here. You should be having a clarity, no confusion. To reduce the confusion, to reduce the error factor, we are came up with prediction series. Okay. Yes. Coming on to this, here the baby is in right occipital posterior position, then it is turning internally to left occipital posterior position. Okay, this is direct occipital anterior, direct occipital posterior, right occipital transverse and left occipital transverse, LOA, ROP, ROA, LOP. Okay, yes. What is the condition demonstrated in this image below the fetal heart rate? So before that, I want to explain you the concept. Okay. Yes, it is easy. Sir, please explain this. What to explain? I have told this. They have asked the rotation. They have asked from the right occipital posterior to the left occipital posterior during normal delivery. They have asked. So when the baby is turning from right occipital to the left occipital posterior, it indicates, see, engagement happened here. So descent happened here. Flexion. After that, first internal rotation only takes place. In flexion, there won't be any movement. In internal rotation, there will be a movement from one angle to another angle. That is from the right occipital posterior to the left occipital posterior. So that first movement is internal rotation in the angle manner. Okay, that is the thing. Yes, it is variable deceleration. Variable deceleration happens due to cord compression. Okay. Early deceleration. Early deceleration happens due to head compression. Acceleration. It is okay. Late deceleration, placental insufficiency, needs immediate intervention. Positioning, oxygen. 2 should be given. Fetal hypoxia, it indicates. Okay. Yes. Correct. It is early deceleration. Okay. If it is a late deceleration, what will happen? Due to increased uterine contraction, there will be decreased fetal heart rate. Due to increased fetal contraction, the fetal heart rate will decrease. It indicates fetal hypoxia. When there is an early deceleration, simultaneously there will be increase in fetal, that is uterine contraction and fetal heart rate. You can remember sawtooth. Okay, it will be like same. Okay, that is early deceleration. Acceleration, no need of doing anything. You can see this is the uterine contraction. There will be variable deceleration is there. Sudden increase and decrease, there won't be any particular pattern. Okay, paw shaped we can see. Yes, variable deceleration. So here comes the point. I have told you early deceleration, you can see there will be decrease in fetal heart rate when there is an increased uterine contraction. When there is a variable deceleration, there won't be any pattern. Okay, uterine contractions will be constant, but sudden drop in fetal heart rate, and it too persists. The interval is persisting more. Late deceleration, when there is an increased uterine contraction, there will be a decreased fetal heart rate. Okay, yes. Feto-placental insufficiency, that is fetal hypoxia we can say. Painless vaginal bleeding, 3rd trimester, easy question, no need to explain. Placenta previa, right? Yes. Next question. In the context of intrauterine growth, that is restriction, and fetal demens, Spalding sign refers to which of the following? Absence of fetal heart tones, cross edema of the fetal scalp, overlapping of the fetal skull bones, gas within the fetal circulatory system. Now tell me. Yes. See? Yes. If over, that is Spalding sign is intrauterine resuscitation, then there will be movement, that is overlapping of the skull bones will be there. Okay. Gas is Roberts signs, correct. Stallworthy sign, easy, but the scenario is same. So then if Stallworthy sign is there, then go for the option. If it is persisted with any other, correlating with any other condition, you just see that is characterized by showing of the fetal heart rate upon pressing the fetal head down in the pelvis, followed by recovery when pressure is released, may be indicative of which condition they are asking. So it is, there are two types. Okay, there are 4 types of placenta previa. In type 2 we are having anterior and posterior. This type 2 posterior is very dangerous, and which is showing pelvis, that is when the pressure is released, head down, and Spalding sign you can see. Okay, it indicates posterior situated placenta previa. Okay, yes. Coming on to this next question, a woman presents with vulval hematoma within 24 hours of delivery. What should be the priority nursing action? They are asking about priority nursing action. Ice pack application, monitor the hematoma of any other worsening pain, ambulate the patient to the ward, monitor vital signs. Now tell me, vulval hematoma during the puerperium, this is after the delivery it is going to happen. What are the clinical signs you are going to observe in the mother? Clinical signs you are going to observe in the mother. Yes. So they are asking about vulval hematoma within 24 hours of delivery. What should be the priority nursing action? Okay. What point in monitoring the hematoma for worsening pain? Okay. Always remember, vulval hematoma, pain is the hallmark sign first. If vulval hematoma formed, this is the uterus means, consider this as a uterus. If it is forming in the upper uterine segment, then it is concealed like abruptoplacenta. What it does, it pain along with uterine enlargement will be there. Uterine enlargement, that is the fundal height the uterine enlargement, the abdomen circumference will be increasing. Bleeding is positive, patient will go for hypotension, that is hypovolemic shock, and death is most prominent in this vulval hematoma. Please be conscious, patient will be having pain. First we have to monitor that, and there will be concealed variety type is also there, so that ice pack application is first and foremost nursing action, okay, to reduce the symptoms of vulval hematoma. Okay, what are the symptoms? Severe vulvar pain, okay, disproportionate pain will be there, swelling and tender bluish mass on vulva you can see, and feeling of pressure, that is fullness you can see in the perineum, shock symptoms, and followed by out of visible portion blood loss will be there due to concealed bleeding. Okay, urinary retention will be there, and that is difficulty in micturition will be there, and difficulty in sitting or walking. The patient cannot able to move, and there will be severe pain we cannot able to identify. Then you have to inspect the vulva whether there is an discoloration is there or not, then uterine enlargement is there or not, then pain. First is pain, then if the pain is there, then inspect the perineum, then fundal, that is the uterine circumference, whether it is increasing or decreasing. That is the point you should note, that is the important nursing action. Then for controlling that, ice pack application, the first nursing action. Don't think on the physician aspect. Our role is to take care of the patient and reduce the symptoms. Okay, and assessment plus taking care. Okay, in this point, vulval hematoma, what is the point in monitoring the patient pain? We have to do some action, right? Already they have told vulval hematoma for 24 hours, the patient will be having pain. So what is the next nursing action they are asking? Okay, that is a point you should note. Correct. A patient delivers a stillborn baby as thick placenta and the baby has rashes on the body. This is suggestive of which infection? Come on, tell me it is. Easy question. Treponema pallidum. Okay. The hydrodrop fetalis is there. In stillbirth, hydrodrop fetalis is there. Then we go for cytomegalovirus. Here, they have given rashes on the body with thick placenta. Okay, thick placenta and only rashes they have given. This Treponema pallidum is highlighted in giving this point. What about this Parvo B19? It causes hydrodrop fetalis, severe anemia and fetal demens. And placenta may be pale, but rash is not the hallmark in Parvo B19 virus. Okay, rubella virus is a congenital rubella, which is a classic triad, that is mulberry muffin rash, okay, cataracts, PDA and deafness. These are the classical triad, and mulberry muffin rash. But in stillbirth, thick placenta are not the typical sign in rubella. Okay, what is the classic triad of rubella? Cataracts, patent ductus arteriosus and deafness. Okay, yes, thick placenta is the key point. Yes, thank you. That is Suryash Chand. You have noted this key point. Thick placenta they have asked, so it is Treponema pallidum. The sign not associated with fetal death. Stahlworthy sign, that is Maccaration, Robert sign, Spalding sign. And sensorineural hearing loss also will be there. I think congenital rubella syndrome. Okay, yes. Classic triad has this 3 points only. That is deafness is, yes, you are right. You are right. Sensorineural hearing loss. Correct, correct, correct. Yes. Stahlworthy sign will be seen in which condition? Now tell me. Stahlworthy sign is seen in, now only we have discussed Stahlworthy sign. Is seen in placenta previa, right? Yes, correct. So now macration is the exposure of the skin towards the environment after the death. Okay, that is the macration. Okay, it occurs after the death. Okay, don't think that. Yes, correct. Lifespan of ovum is, already I have told, it is an easy question. It is 12 to 24 hours. Coming on to this, match the following again. Eager's sign, softening of the lower uterine segment. Chadwick sign, bluish discoloration of the cervical vaginal mucosa. Goodell sign, softening of the vaginal portion of the cervix. That is Pichek sign, lateral bulge or soft prominence of the uterus. Unequal uterine growth at implantation site. Is A? Sure? So now we are going to make a match. Eager's sign, softening of the lower uterine segment, that is especially in the isthmus. Correct. Chadwick sign. Okay. Dusky hook. Also a keyword. Fluid discoloration of the cervix and vaginal mucosa. Correct. Goodell sign, softening of the vaginal portion of the cervix and Check sign, lateral bulge of the or soft prominence, that will be abnormal. In the implantation side there will be unequal uterine growth. So now tell me, sometimes they may trick you. Don't confuse here. The answer will be B. Okay. These are most probably occurs at 6 to 8 weeks. Okay. Yes. Now tell me, a female patient G4, that is gravida 4, visits the clinic for antenatal checkup. At 24 weeks of gestation, the female had 3 abortions and the height is 5.6, weight is 60 and feels fatigued. What may be the probable cause of gestational DM in this female patient? It is fatigue, abortion, multiparity or obesity. Come on, tell me. It is B, due to obesity. It's a very small question. Okay. A patient presents with foul smelling discharge, fever is there in the OPD after 5 days of delivery. Lower abdomen tenderness is elicited, that is elicited on examination. The nurse should suspect which of the following condition: endometriosis, bacterial vaginosis, puerperal sepsis and urinary tract infection. Fever is there, foul smelling within 5 days. So in endometriosis, there will be severe pain will be there, and within 5 days there won't be any foul smelling discharge. Foul smelling discharge is there, it is due to puerperal sepsis. Okay, puerperal sepsis. If it's whitey discharge or any other discoloration of discharge is there, then we can go for bacterial vaginosis. But the answer is puerperal sepsis. Next question. A patient female is presented with labor in the fetal head appearing in the vaginal opening and the fetal diameter is closing the introitus. That is a keyword here. Crossing the introitus. Which of the fetal head is visible? With the fetal head is visible. They are talking about cardinal movements of the labor. Okay, cardinal movements. They are talking about the cardinal movements in which point the fetal head is visible and crossing the introitus. Yes, crowning. Correct. It is crowning, right? A female in the postpartum period after 1 month of delivery feels breast pain and difficulty in the breastfeeding. On examination, warmth and tenderness over the left breast are noted. A temperature is 38.3 degree and a WBC count is quite increased. Identify the condition. It is mastitis, breast abscess, breast engorgement or breast cyst. Breast engorgement. No, patient is having pain and warmth and tenderness is there. Yes, it is mastitis. Engorgement, there will be minimal pain and I think there won't be any warmth will be present. Okay, yes. Tenderness is over the left breast are noted. Okay, it is mastitis. Next question, which of the following diseases can occur due to RH incompatibility? First remember, RH incompatibility occurs if the RH negative mother give to birth to RH positive fetus. Okay, there is positive father, RH father. Okay, then the first pregnancy. Second pregnancy, this antibodies are against delivered, that is presented, formulated against to this RH positive fetus. It is sensitized. It will develop antibodies against the developing fetus again in the second pregnancy. For that only we are giving anti-D dosage. Okay, anti-D dosage at 28 weeks of 300 mcg. Okay, yes. Now tell me, which of the following diseases can happen? that is acute hemolytic disease, and most probably there are chances of, that is jaundice. Severe jaundice is also possible. These are the things you should note. Okay, yes. Now comes the point. Following set of instruments are used for which of the procedures? Easily you can say, already we have told, it is pap smear kit. Okay, next question. Dusky hue of vestibule and anterior vaginal wall. Dusky hue, that is Egersign, Chadwick's, Osiander or Palmer's sign. Dusky hue. Now tell me this point, it is very easy. Yes, it is Chadwick sign. Easily you can remember. Higa sign, softening of the lower uterine segment. Why I am repeating it again and again? Because you people will make mistake. Not all students, some students will make mistake, because most people will learn everything. While entering into the exam and all, or after seeing the question, you will have confusion. Okay, I have faced this as a student. I have faced lot of confusion in this point, so that I am keep on repeating. Higa sign, softening of the lower uterine segment. H, lower, you can remember. H, downwards. U sign, lower uterine segment softening. Chadwick's bluish discoloration, around 6 to 8 weeks. Osiander, okay, O with pulse. Okay, O with pulse, and Palmer's sign, rhythmic uterine contraction. Palmer. Okay, Palmer's sign is rhythmic uterine contraction in the abdominal wall. Okay. Okay. After pains are seen in, these are probable signs. Yes, presumptive, probable, positive signs. That is also in the YouTube. If you want, you can see the YouTube videos which are uploaded in the Wednesday special series. You can go back and refer the YouTube channel of NNL1. There are plenty of contents are uploaded. Please go through the topic. Okay. Yes. Come on, tell me. Yes, during puerperium. Backs on it contraction. Anything like that comes, then it is go for second and third trimester. Okay. Yes. Compared to the pregnant female, a lactating female would require higher level of nutrient supplement for which of the following? Yes, due to oxytocin, the after pains are coming. This oxytocin reflex mechanism. Yes, correct. Yes, calcium. First, see pregnant female, lactation. This is the keyword here, lactating female. Compared to a pregnant female, lactating female they have given. This is the keyword you should note, calcium. If it is a pregnant, then go for folic acid. Okay, iron supplement. A first trimester resident receives a call from the casualty on unbooked primary gravida at 32 weeks of gestation. She has presented with regular painful uterine contraction. On examination, her cervix is 2 cm dilated. What is the betamethasone injection would the resident give her? Yes, 1200 mg. Yes. Iron requirement throughout pregnancy is 1000 mg, I think. Yes, 1000 mg. Calcium is 1200. 1000 to 1200. See, B comes bigger. Okay, I will give you the clue. Some students will not be able to identify. Okay, I will give you the clue. It is there in the screen, you can see. big dose. Betamethasone, big dose, 12 mg, 2 doses, 24 hours apart. 12 to 24. 12 twos are 24. Like that you remember betamethasone. Okay. Yes. Now comes the divided dose. Okay. 6 mg, 4 doses, 12 hours. Okay. 6 mg, 4 doses. Once you remember this, it will be very easy. Okay. 4 divided doses. Okay. In this alphabet comes at 4. Okay. 4 divided doses. 6 mg, 4 doses, 12 hours apart. Every 12 hours we are going to give. 24 hours apart, that is betamethasone. Okay. Yes. Correctly you can remember. Please go through the points. A 26-year-old woman presents with cramping and heavy vaginal bleeding at 10 weeks of gestation. She had a previous cesarean delivery 2 years ago. Ultrasound confirms a diagnosis of incomplete abortion with retained products of conception. What is the management? Manual evacuation of aspiration, okay, dilatation and curettage, dilatation and evacuation, hysterectomy. In this point, at 10 weeks only, okay, we can do what? Yes, we can do manual vacuum aspiration. Yes. Coming on to the next point. Which are the following statement are true about congenital rubella except? It is diagnosed when the infant has IgM antibody. Yes, it is the primary thing. Okay. Antibodies at birth. It is diagnosed when IgG antibodies presents more than 6 months. Yes, obviously it is correct. Most common congenital defects are, yes, sensorineural hearing loss, cardiac, that is malformations PDA, and cataract. Yes, correct. Infections after 16 weeks of gestations is the major congenital defects. So this is also will be there. This won't will be there because after 16 weeks it will not be an infective part. Before 6 weeks, that is, if the infection is before 16 weeks, then it is going to be congenital rubella syndrome. So D will be the answer. You may think this might be like easy questions, but these are very tricky. When you see in your exam, you will face. Okay, results of quadruple screening. Okay, maternal serum alpha fetoprotein, it is low. These are first column. This is second column, and this is third column. They are asking about chromosomal abnormalities here. Okay, HCG is high. In this first congenital unconjugated estriol, it is also low. In Inhibin A, it is also high. Now tell me which will be the answer. If you know the first two, then you can easily predict the third one. Yes, it is. Trisomy 21 is Down syndrome. Trisomy 18 is Edward or Pataya syndrome. Neural tube defect is also there. In Inhibin A, it is high. Now tell me. Okay, I will give you the clue here. Okay, yes. If it is Down syndrome, 2 will be up and 2 will be down. What are the two things will be up? HCG and Inhibin A will be increased, will be high. If it is two things are low, what are the two things are down? Alpha fetoprotein and estriol will be low. Then it is called Down syndrome. In Edwards, that is 18, it is all will be down. That is HCG, Inhibin, alpha fetoprotein and estriol will be low. These are the things. Okay. Neural tube defects, only alpha fetoprotein we are taking into account. Quadruple test, two things will be up and two things will be down. That is in Down syndrome. In Edwards syndrome, only all will be down, and in neural tube defects, only one thing we are going to consider, that is alpha fetoprotein. Okay. Yes, don't be confusing here. A 21-year-old woman who is at 8 weeks of gestation presents with increased frequency of vomiting, okay, increased frequency of vomiting, and also associated with retching. She shows no signs of dehydration, volume depletion. Which of the following option you suggest in this scenario? Okay, retching they have told, and increased frequency of vomiting is there, so dehydration is there. What is the acid base imbalance? Easily you can remember, that is metabolic alkalosis. Which electrolyte will be lost here? Potassium. Obviously we have to replace this. So what is the best option here? Progesterone we won't give because it is a steroid. It will decrease the potassium value, so we are not going to give this. Hydrocortisone, again we are not going to give this. Doxylamine and vitamin B6 we can consider because it can restore the component. Okay, IV fluids and thiamine we can give if there is severe dehydration symptoms. We can give IV fluids plus thiamine, but in this scenario this thing is very, very important. Okay, yes, correct, yes, correct. So IV fluids will not give, so that's what I was telling. In this, B6 is very important because doxylamine, which will, because 8 weeks of gestation, okay, increased, this is not hyperemesis gravidarum, it is induced vomiting, that is nausea and vomiting is there, and patient with associated with retching, and no signs of dehydration they have told, and volume depletion is also not there. So then why, what we are giving fluid volume overload? Known overload, and don't give thiamine. Okay, no signs of dehydration. Yes, easy. Next question. During a routine checkup of multigravida at 32 weeks of gestation, the fetus was found to be breech presentation. The obstetrician planned to an external cephalic version. What is the ideal time to do this procedure? What is the ideal time to do this procedure? Come on, tell me. Yes, ideal time is 37 weeks. Before 37 weeks it is not indicated. Okay, yes. Next question. Identify the given condition below. It is complete placenta previa. Okay, I will just be behind the image. I have put the image. Partial placenta previa, marginal placenta previa, low lying placenta previa. Now tell me. Easy, right? Marginal placenta previa. Okay, yes. Here comes the question. What is the topograph show? Deceleration, acceleration, normal, deceleration followed by acceleration. Yes, it is deceleration. If it is an acceleration, there will be increased in fetal heart rate. Then you can choose that option. They have given no uterine contraction is there, then there won't be acceleration is also. Acceleration is increasing in the fetal heart rate. There won't be any acceleration also, only deceleration. Decreased fetal heart rate till 80. Then it is again normal. Then it is again going to 60. So it is deceleration. Okay, yes. Now tell me, identify the maneuver shown in the image. It is Burn Marshall, Lowset, Merrique, that is Smiley MSV maneuver, and Ridgens maneuver. Here, first they are putting down, fundal pressure is given, then again they are hyperextending the fetal limbs. Now tell me, this Burn Marshall technique. Only if Pinard's maneuver, only we are going to remove the fetal through the breech presentation, we are going to remove the fetal through the limbs. But first they have, the delivery is done, then to the head delivery of the head, what they are doing, first they are giving the fundal pressure, then it is extended upwards. Okay, against the gravity we are going to do. Okay, yes. The last question, a pregnant woman presented to the clinic with the following fetal presentation. What likely the diagnosis? It is stargazer breach, complete breach, flexed breach, and flank breach. Now tell me. Grasping head, yes. Pinard is leg. Only leg movement we are delivering the baby. Okay. In Brecht's maneuver, there we will be using only hyperextension of the fetal head against the gravida. We are going to deliver the fetal head. In this, first downwards we are giving the fundal pressure, against the fundal pressure, then we are hyperextending the fetal head and delivering via the fetal limbs. Okay, yes, it is flank breach. What is this stargazer breach? Stargazer breach is which is a very important condition where there will be much hyperextension of the neck will be there. So which is a life-threatening condition, which is very important thing you should know, that is stargazer breach, where hyperextended neck will be there. Another one key point, please make a note, that is stargazer breach. These are the important points. This is cephalic presentation, posterior presentation, transverse, where the fetal that is spine is laterally positioned, complete breach, okay, where the limbs are flexed, flank somehow extended, that is extended of the limbs, and you can see footling breach, one foot is down towards the cervix. Okay, yes, that's all about the points. Okay, is there any doubt? So again, all the best for your exam. These are some predicted questions from this. Whatever topics I have chosen, you just revise the topics. From this, there are most probably you will get the questions. Apart from that, you can read the basic anatomical structures, like which is the support of the uterus, blood supply, everything which are very important you can do, and most probably you can revise the contraceptive parts, and as well as some of the important topics related to the trimester wise screening. Okay, these are the important points you should note. And labor and abnormalities of the labor, like GDM, you all know about the GDM management, and regarding the preeclampsia and the gestational hypertension, everything you know. Okay, these are the important points. And always remember, first and foremost, please children, please first and foremost read the question properly. Read the question properly. First point is that. Second is keep calm. Okay, if you don't know the answer, please be calm. You will be very anxious. Okay, please be calm. Think and answer. Think and answer. Third is always analyzing the keyword and answer. Keyword analysis is very important, and time management is also very, very important. Okay, first section wise you divide 9/9 criteria. That is our rule. First 9 minutes you are going to assess your points, and 100% known questions you are going to write. After 9 minutes you are going to divide and answer. Okay, yes, this is the important points. And upcoming within the days we will come up with one more session, okay, regarding any other subjects. These are some predicted points which is from our side. All the best for your exam. I hope your revision is very, very important. Revision is the key for the success. You will be there as a nursing officer. Hopefully all the best. Comment me any important points you want, we will discuss. Okay, thank you so much. Thank you all.